One of the biggest changes that I've noted in restorative dentistry, particularly restorative, is that we tend to want to get in early. When I first started, we'd wait for a while, we'd get in big round burrs and really take a lot of the tooth away, and then we put in big amalgam fillings, and that weakened the tooth. And unfortunately, every day now we see teeth that have got cracks in them because the dentist has actually weakened the tooth by putting in a large restoration. What we try and do now is we try and get in early, and we can use devices that can pick up decay very early, as well as using our vision. We don't go and probe into a tooth with a probe anymore because that can even start decay in a tooth, so we don't want to do that. So we use things like lasers and vision and a few other devices where we can detect early decay. We may just sandblast it out with some air abrasion, or we may get in there with a tiny, tiny fissure burr and just remove the bit of decay, and then we put a fissure sealant or a filling in the tooth, which then gets into the grooves and doesn't cause the tooth, a lot of tooth loss. The problem with doing a large restoration is you weaken the tooth. If you get in early, then what happens is you do minimal invasion of the tooth, and that's critical because this tooth has got to survive until you may be 110. And it's the only one you're going to get, all right? So you don't want to drill into a tooth unless you really have to. And that's why preventive dentistry is so important now. And there's materials, or chemicals I should say, that we can use now that will stop tooth decay. You just got to get your dentist to tell you about it because they do exist. And also flossing and brushing correctly is most important. But this type of dentistry is called minimal invasive dentistry, and you'll see your dentist these days who'll sometimes work under a microscope or will have, vision, where they have these goggles on your face that look a bit weird. But the thing about it is what he's seeing is he's looking at your teeth with magnification, and he's getting in early, because if he sees changes in the structure of the tooth, it's best to get in early than get in late. Because the last thing you want to do is get a big round burr and drill out a large amount of tooth decay. That's why preventive care and minimal invasion of teeth is the biggest changes that I've seen in dentistry.